Good afternoon and welcome to Ducks in a Row Advanced Directives for Healthcare. My name is Beverly and I'm the Communications Manager for People's Memorial Association. People's Memorial Association would like to acknowledge the traditional, ancestral, unceded territory of the Coast Salish, Duwamish, and Suquamish nations on which we work and live. Before we get started today, I just have a couple of standard housekeeping items. We're going to go ahead and keep all of our participants on mute today, but if any questions occur to you, please feel free to drop them into the chat or use the Q&A feature. And if you're feeling a little bit shy, feel free to send your question directly to me or to Bonnie, and we'll make sure those get addressed. And I think if I remember correctly, Bonnie even promised that I could interrupt her with your questions as they become relevant. So we'll be able to get all kinds of good information out of her today. If this is your first time joining us, welcome. And it's possible you maybe haven't heard of People's Memorial and that you were brought to us by our friends over at the Seattle Public Libraries. We're so excited to have so many folks joining us today. PMA is the oldest and largest memorial society in the US. We were founded in 1939 right here in Seattle. We are the only nonprofit in Washington providing funeral education and advocacy, but if you happen to be joining us from out of state, no worries. There's about 73 similar organizations under the umbrella of the Funeral Consumers Alliance, which is a national organization. So it's distinctly possible there's another organization doing similar work a little closer to your own home. For our membership, to date, over 215,000 people have joined, and of those folks, about 71,000 of them are still living. So we stay pretty busy in the office. And when we think about what that busy looks like, one of the biggest things we do is offer educational series, just like this Ducks in a Row series, and tons of resources all over our website. So I stay pretty busy doing the programming, but we also do spend a good amount of time doing state level legislative lobbying as part of our advocacy work. We aim to support our state legislature in the increase of funeral choice, the increase in price transparency in a notoriously opaque industry. And we work really hard to make sure that Washingtonians have access to affordable cremation, burial, aquamation, natural organic reduction, and any kind of funeral practices that are an essential part of their culture, their faith, and they're just general cultural requirements. We all come from different backgrounds, and we have a wonderfully diverse number of populations here in Washington, and they all deserve equal access to the funeral practices that meet those needs. And we also don't want them to go into any unnecessary debt in this process of seeking out those resources. I am excited to introduce Nancy Sloat. She's joining us from the Seattle Public Library. Our friends over there have helped us bring this series to life again. Last time we offered it was this past fall. Nancy, did you want to go ahead and say a little something?
Hello, everyone. I assume you can hear me. Thank you so much, Beverly. We're really delighted to be able to bring you this series with People's Memorial Association. I know, for one, that I have learned a tremendous amount viewing these webinars in the past. As my slide shows, I'm the Older Adults Program Manager for Seattle Public Library, and I coordinate all the programs and services for older adults. I also have pages on our website called Next Chapter. I'm going to put that URL into the chat, where you'll see all kinds of information about our programmings. You'll see.
Hey, Nancy. I'm sorry to interrupt. It looks like a couple of folks are having a little bit of trouble hearing you. You're speaking kind of softly. Would you raise your voice just a little bit for us?
Okay. I hope that this.
Oh, that's beautiful.
I hope that this is better.
Thank you so much.
I create book lists and sets of resources on aging and older adults, and I will put that information into the chat. I also have a book list on death and dying, and you're welcome to look at that. Just click on that. I will also put that into our chat box. I know that Bonnie has created an excellent presentation today in a, I'm trying to talk up. I can see that it's still a problem with my voice. I know that Bonnie has created a great presentation, and I would like to turn this back now to Beverly so that we can get on with the presentation.
Wonderful. Thank you so much, Nancy. Just a reminder that today's presentation is part of a series. There's one more session next week, and I'll be presenting an updated version of our funeral options class. And then the week after, we'll be having an estate planning class. And so these are probably, if you've joined us before, it's distinctly possible this is some pretty similar content, but we've tried to get some updates in here for different things that have changed in the last couple of years. And so we'd love it if you could join us for the whole series. And I'll go ahead and make sure we send out a follow-up email after today's presentation with a recording of the session, as well as links to these upcoming sessions and some of those resources that Nancy offered up, because there are some great stuff in there. I'm personally a huge fan of that Death and Dying book list. Well, I'm really excited to go ahead and welcome once again Bonnie Bizzell, the Community Engagement Liaison and Program Manager from Honoring Choices Pacific Northwest. We love it when she comes and presents for us. Welcome, Bonnie.
Thank you so much. I love it when I can come and present for you and with you. So I am going to ask to take over the screen. So bear with me as I do that. And if you can't hear me, please let me know, or let Beverly. Beverly, feel free to chime in. I know that different computers have different levels set. And so sometimes it's like listening to all different sort of digital music. You never know if it's going to be super loud or super quiet. So, well, welcome. I'm so excited to be here. I also want to just acknowledge that Honoring Choices Pacific Northwest sits on the land of the first people of Seattle, the DPOAHC people. And so we want to just honor and offer gratitude to the DPOAHC past and present and future for their ongoing stewardship. And we ask that wherever you're at, that you take a moment to reflect just and acknowledge the ongoing stewardship that Indigenous people have done for us and for our lands. The next thing I want to do is I want to congratulate you. Yeah, you for being here. That's amazing. We'll talk about how a lot of people want to do this and don't know how to start in just a little bit. But I think especially now when we're still in a pandemic, we're still trying to muddle our way through a lot of things. You know, advanced care planning is one of the ways that we can feel like we have some control. And so I'm really happy that you're here today. I really appreciate that you are. And I saw someone say, hey, how often should we update this? Well, I'm going to tell you right now up front that, you know, I look at mine every birthday, but maybe that's just because this is my job. But anytime there's something significant that happens, certainly like a pandemic, is a great time to reflect on your values and preferences and review what you've already done. If you've already done your advanced care planning, if you've done an advanced directive, if you haven't started, that's okay. I'm going to help you get started today. And it's not going to be as hard as you think, I hope, hopefully. So I think one of the things that I like to always say too is like anything, advanced care planning is a plan. So sometimes even when we plan things, they kind of go sideways. They don't happen exactly what we want. But the point is that if people know what you want, they can get you closer to that. I saw a beautiful post on Twitter just yesterday from a person who whose friend was in the process of dying and really had wanted to be at home, but because of their condition couldn't. So they had brought photos and they had brought like a blanket and a bunch of stuff so that where she was at, she could feel more like she was at home. And so I think that's important to know that even if your plan doesn't come fulfilled 100%, it gives people an idea of maybe what they should be focusing on and what they should be doing for you. So let's get started. So I always like to tell people who we are in case you don't know who we are, so that you know where you're getting your information. I think in today's age, it's really important to know where you're getting your facts from. So I work with Honoring Choices Pacific Northwest. We are a joint initiative between the Washington State Hospital Association and the Washington State Medical Association. And the reason that's really awesome that they've joined together to do this is because, you know, if you're at the end of life for a loved one, the odds are you're either going to be in a hospital and or you're going to deal with a provider, a doctor of some sort. So it's really great that both of these institutions, these organizations, realize how important it is to do advanced care planning. And our vision is kind of simple, that everyone will receive care that honors personal values and goals at the end of life. It's not my values and goals. It's not the hospitals. It's not the doctors. It's your personal values and goals at the end of life. And the way we do that is we want to inspire conversations. So like People's Memorial, we do presentations, and we also help people make informed choices about end-of-life healthcare by providing information and different ways to think about things. We also, in addition to working with individuals and helping individuals or families, we also work with healthcare and community organizations. So we train them to have these conversations. We help them learn how they can discuss and record and honor, if that's something they can do, if that's within their realm, into those end-of-life choices. So I like to always throw this out there. If you know of a group, a church group, a book club or whatever that wants to help people do advanced care planning, let me know. I'll help you do it. We are a philanthropic nonprofit, so everything we do is free. So whether I'm helping someone one-on-one or I'm training a class, it's free, because we really do want everyone to have that care. So what does that mean, that care? Well, what do we do with that, all that stuff? We have 3 goals for everyone who's 18 and older. We want people to talk about it. We want people to write it down, and we want people to share it around. So what does that mean? Hey, you know what? People need to explore. They need to ask questions. They need to discover what is actually important to them. And then if they want to, they need to formally write it down. Either in a legal document or some other way would be great. But you know, we really want people to share it around, and so one of the easiest ways is to write it down, but we want people to make sure that everyone who cares about them knows what their wishes are, because even though you might dedicate one person or have a few people who are your healthcare agents, I'll talk about what that is later, you still want everyone to be able to be supportive and sort of know what's going on. So like that Twitter example that I just gave, all of these people came together to make sure that this woman had that her hospital room really felt like her home. So today, just so you know, we're really kind of focusing on the first 2, not the last one, but that's okay. You know, sharing it around can be pretty simple. It's a matter of just starting to talk about it. So talking about it, I would like to dive into this question before we even get into what is advanced care planning and all the other stuff. What brings you joy? What brings you joy in your day-to-day life? And as you think about this, I'd love it if you feel up to it to put it in the chat. I love to hear what brings people joy in their day-to-day lives. As you think about it, I'm going to share you something that brings me joy. So I have a dog. He is, I'm not kidding, the cutest dog ever. He's part Beagle, part Jack Russell, so he's all cute. And I love playing with him. I get on the ground, I tussle with him, I do an open growl, you know, I roll around, I play tug of war. I'm a very physical player with my dog. And you know what? That brings me joy every single day. Beverly, are we getting is anybody telling us what their joys is? I would love to hear some.
Yeah, we got a couple good ones. I got it started because it really brings me a lot of joy when 75 people join me for a webinar on a Monday.
Oh my gosh!
So I'm pretty excited. We also have a couple of fellow animal lovers in today's session. We've got one person that says my cats and dog. Someone else says their dog is the cutest. I hope you guys have to fight that out.
Oh, them fighting words. No, I'm kidding. I'm a lover, not a fighter, so.
Well, I think there's also some people that identify similarly, because someone else said sharing life and laughter and snuggles with their partner. Someone else really vibing with nature and water. Oh, some other book lovers here for you, Nancy. Some folks are identifying with reading being a big source of joy. Ooh, yeah, lots of outdoorsy people. I think it's the weather. It's getting us all thinking about our daily walks in nature. Ooh, someone says flowers in bloom and wild birds.
Ooh.
Lots of good
These
stuff.
are all fantastic things, and they all tell you something, believe it or not, that is important to your advanced care planning. So advanced care planning really is identifying those things that bring you joy. So whether it's being able to commune with nature or sharing laughter with people who matter to you, or snuggles, or reading a good book and being able to just drench yourself in another world through words. These are all important things, and they're things you should hold on to as you think about advanced care planning. So what is advanced care planning? Advanced care planning is a process. It is an ongoing process of communication between individuals and others, usually they're healthcare agents, people who matter to them, providers, about what's important to them. It's a process of reflecting on and discussing and planning those future healthcare decisions. So that if a time happens when you can't make your own decision, you have people in your life who can make that decision for you. Not because they're imposing what they think, but because they know you so well and you've talked about it, that they're actually channeling what you would want and being your advocate in that space. Now, part of this process, as you can see in the gray circle, is something called an advance directive. And an advance directive is simply a document or a set of documents that outlines and records a person's preference. They're usually legal documents, and there are a variety of different types. There's the durable power of attorney for healthcare, which is where you can name your healthcare agent. You can see DPOAHC in that blue circle. There's a healthcare directive. That's what HCD stands for there. And that's, a lot of people call that the living will. And then we've also added the POLST, which is the physician's order for life-sustaining treatment, because it can determine the kind of healthcare you get. So the important thing to remember is that, hey, documents are important and they're part of it and they're an important part, but they're not the only part. Discussing and talking about it is really key to the whole process. And while I'm here, I just want to let you know, look, if you don't want to do any of these documents, the legal documents, the POLST, those are all voluntary. You don't have to. There are other ways that you can communicate. One of the ones that comes to my mind is a person wrote a beautiful letter. He had actually chosen his eldest to be a healthcare agent, so he had that legal, but I think of the letter as a beautiful way to, like, he laid out for each of his children, what their role was, because based on their talents. So, his eldest was, actually it wasn't his eldest, that's why he did the letter. His eldest was really good at welcoming people and making them feel comfortable and safe, and also very good at protecting people from, like spending too much time and wearing out their welcome. And so the eldest was actually, he wrote, you're really good at this. And so this is what I want you to do for me around the end of my life, is I want you to make sure people feel welcome to visit me, and also help them know when it's time to, their visit is over. And then the next one was the second kid was really great at making decisions, and I've chosen this person to be my healthcare agent. Beverly, did you have a question?
I did. You were in a flow, though. I didn't want to interrupt.
That's okay.
Will you remind me what the difference between your POLST and your advanced directive is?
Yeah. So a POLST is a set of medical orders. It's done with a doctor, and we'll actually talk in more in depth later on about around what a POLST is and what an advanced directive is. An advanced directive is more about what ifs, and I'll get to that in just a minute. So just hang with me. And if I don't answer your question, make sure you just ping us again and I'll clarify it. All right. But that's a great question. Oh, I was going to give one more example of a non-legal document that still communicated wishes. A person of Hmong descent decided not to do a legal document and did a good job certificate. So, those certificates you can just buy like at Office Depot or whatever. But it said, good job. You've done a good job when my heart stops beating, and you let me die naturally. Now, it's not a legal document, but it certainly told those who mattered to him and his providers what he wanted and what he preferred. So I just like to point out those two examples so that you know that there are different ways or other ways besides legal documents should you not want to do a legal document. So I know we're really anxious to get into the documents, but I want to take a step back and just talk about why we want to do advanced care planning. I think advanced care planning in the name tells us it'll help us later. And so why is it important to a community, to whomever, to do it? Well, you know, I'm not going to read out all the statistics. You can see that on the screen. But, you know, a lot of people want to do this and they just haven't. Like, they just don't. And if we think it's hard to just talk about it, which is really hard, writing it down is even harder. It's hard to put wishes in writing. True story. It took me a year after getting this job to actually be able to put pen down in paper. So just know that it can be really hard to put it down in writing. And so what does that mean? If we don't talk about it and we don't write it down, what happens? Well, then people don't die where they want to die. They end up in a facility or a hospital. And let me get these last 2 points. I see you, Beverly. And, you know, it's not only the individual, it's the people who care about that individual who are impacted. Prolonged grief happens, PTSD, higher rates of both of those happen. So it's really a gift that you can give to others in addition to sort of taking care of what you want as well. Question, Beverly.
I appreciate you so much fessing up to not having done those documents immediately, because admittedly mine aren't done either.
That's okay, no shame.
Oh yeah, my office mate is just shaking his head at me right now. It's shameful. No, I'm looking at these numbers about the prolonged grief and the likelihood of PTSD, and they're just stunning. Could you speak to maybe what some of those things are, those barriers that keep people from filling this out? Because you mentioned how hard it can be, and even when we work in these related organizations, we hesitate. What are some of the common things you hear?
Well, you know, I think a lot of it is sometimes people think it's going to be really sad, and it's gonna take them down a road that they don't want to go, and there might be some sadness involved, right? But also there, you know, like my first question is, what brings you joy? It really is about how you want to live, not how you want to die. And so I think sort of shifting that perspective. A lot of people think that if they talk about it, they're inviting death into their home. And I am not going to say, you know, it's not me to say, no, that's not true. Although, you know, I think there needs to be some sort of understanding of how do you walk with death then. If you don't want to invite death into your home, how can you walk with death? Because we all die. I mean, we all die. That's the one thing that we all have in common is we're born and we die. And then I think, you know, another thing that really is hard, certainly to the writing, I think sometimes it's easier to talk about stuff. I know for me is I identified a lot of values and preferences. I identified how I wanted to live and what was important to me. And then I looked at how I was living, and, you know, my values were different than how I was expressing my values in my day-to-day life. And so I had to figure out how to combine those, how to make peace with those, or what that looked like. And so sometimes I think we realize things about ourselves, and then we do deeper reflection. So I think there can be a multitude of reasons. It could just be, I am busy. I don't have time to do this. It could be a lot of things. And I think that's okay. I think what I would encourage is that, you know, even just talking about people about what makes you you can help people to start understanding what that might look like, even if you're not broaching end of life care, for example.
That's a good point. Yeah, someone messaged us and said that they believe that most Americans, especially young folks, they have a difficult time discussing and dealing with death in a personal kind of way because, you know, kids grow up and the process of death is rarely discussed as a matter of fact subject, and it's a real shame. It's a missed opportunity.
Well, and that's why I say, you know, look to the news. Gossip about celebrities. There's always something going on where you can elevate. Like just recently, poor DMX, who I grew up listening to. You know, he was on life support, and you know, so I know that may not be DMX. The younger crowd may not know who DMX is.
I was going to say, I'm a little bit surprised to hear you're a fan, but we'll touch base on that on a different day.
But you know, he did bring Def Jam Records back to the forefront. So anyway, I'm not going to go off on that. But the thing is that there are other ways to broach these subjects, and a lot of times you don't have to talk about yourself. You can look at different books. Watch the Avengers. A lot of people die in the Avengers. Watch the Avengers and talk about what would it feel like? How would you be able to make decisions for people? So I think there are a lot of different ways. I don't want to go into those. And if you want more ideas, trust me, I have more ways for you at the end of this PowerPoint. So
okay, can I give you one more question and then I'll let you get back to your
yeah, sure.
Okay, so someone is kind of curious about the consequences. Like we can see here that, you know, people want to die at home, but by and large, that's not happening. What happens if you don't do your documents? You know, they ask, is it problematic if you don't do this paperwork? Well, what will the doctors do if it comes time for these decisions to be made? Are they just going to do that heroic effort to try and save your life if they don't have direction otherwise? What happens?
So I want to say that providers, by and large, want to either give you the care you want or not give you the care you don't want. I know that's a little long way of saying that. And that's why I encourage talking about it, because most of the time they're going to ask people who could make these decisions what they think those decisions would be. And so even if there isn't that paperwork, for example, if you've got someone who's well informed about, who can say, oh yeah, I remember I actually talked to this person, I talked to them about this, and this is what they felt or what have you, that will make a huge difference. The default, honestly, is everything. And that's the default in most medical situations, but it doesn't have to be the default for you. And I think that's important to take forward, is that you can help decide that. You can make sure that that decision is yours and not someone else's. So, and I have a lot more and I want to get to it. And I think some questions might be answered. I don't know, but I love having all these questions because it just,
I was going to say, I'm seeing some really wonderful feedback from folks about how great it is to like really start to think about how we can have these conversations in a productive way with the people we love. So you do your thing. I'll be.
I've got to do my thing. Don't hesitate to interrupt again, because it's really important that people get the information they need. So, okay. So it can happen. It can help us later on, right? At the end of life. But you know what? It can help us now. It can help us right now in the here and now. And I'm not just talking COVID here and now. I'm talking non-COVID here and now. And let me explain how that is. I mentioned this idea. It's about how you want to live, not how you want to die. So, you know, when you plan, you do identify what's important to you. And once you know what's important to you, what your values and preferences are, that means you might be able to create a stronger partnership with your provider. You might be able to increase your understanding of what's happening in your own healthcare. And you might feel activated to ask about your own needs. And let me explain that in 2 quick stories, both true. So in real life, this is what it looks like for me. I, like many of you out there, love the outdoors. I love hiking. I love going out and spending half a day just walking around and listening to the birds, and, you know, I just love it. I think it's wonderful. I am also allergic to just about every tree that's out there in the Pacific Northwest. Needless to say, that's not an ideal situation for someone who likes to hike in the Pacific Northwest. but I have a great allergist. And so if I go to my allergist and my allergist says, you know what, there's this new pill that we think can really help you with all your tree allergies, I'd be like, oh my gosh, that's so awesome. Tell me more about it. What are some of the side effects? And if my allergist said something like, oh, well, you know, you are going to get more, you're going to be more sensitive to the sun. So, you know, you won't be able to be outside in the sun as much, you know, you'd probably want to limit that to a couple hours. Or if my allergist said, you know, it's really great, you're going to be a little bit more lethargic, you may not have the get up and go that you're used to having. I might, in both of those situations, say, not for me. Because if I can't spend 3 to 4 or 5 hours out hiking around in the very limited sunshine that we get, that's not good for me. Or I might say, look, if I don't have the get up to go to actually get up and go, then that's not helping me live the life I want in hiking. So that's one way it can help you. Another way it can help you is, and this is a true story. So Tom Brokaw is a very famous newsman. You probably know him. That's kind of how he talks. I am not an impersonator, so please don't write me on that. But he has a daughter, Dr. Jennifer Brokaw, who started off in the ER and then started her own practice specifically around end of life for complex cases. And she and her dad had a TED Talk about advanced care planning. And he was like, oh yeah, I've planned this, you know, everything I want. And she was like, I have no clue, you know, like I don't even remember getting the paperwork. So they sat down after the TED Talk, not during it, and really, you know, had an in-depth discussion about what he valued and what was important to him and how he wanted to live those outcomes, right? What would a good day look like for him? And they wrote it down. And then several years later, he was actually diagnosed with cancer. And she said the first thing they did is they went back to that document and they said, okay, do these values and preferences, are they still your values and preferences? And he said, yes. And so that when they went to look at treatment options, they were able to root their decisions in what they had written down. And that's true. That was true with my mom too. When she had her second round of non-Hodgkin's lymphoma, we went in and our big thing was like, her joy, what brings her joy every day is a glass of pink champagne. She needs to be drinking that glass of pink champagne, just one glass every day. That's her joy. And we went in and we found out, you know, that she wouldn't be able to have treatment and be able to drink her champagne. So we actually modified our goals so that the goal was that she would be able to get back to drinking pink champagne every day. So she gave up pink champagne for a little bit, but it helped us in that process going through and understanding what treatments, big or small, we would want right now. All right. So what are the legal documents to use? And I've touched on this a little bit. So there are 3 documents that you can see on your screen. The one on the far left with all the pictures of the people, that is the Honoring Choices Pacific Northwest Durable Power of Attorney for Healthcare. That's your healthcare agent form. The one that's in the middle is your healthcare directive. People call that the living will. And the one on the far right, which is technically not a legal document, it's a medical order, is called a POLST. That's your physician's order for life-sustaining treatment. Yes, Beverly.
Hi.
Hi.
So we have someone who's really interested in your advanced directive, but they also have a copy of one from a different organization, from Compassion and Choices over on the East Coast. Could you speak to maybe some landmark items on these directives that are important for people to watch for when they choose which form they use?
Yeah, so there's a couple of things to really, first of all, my first advice, choose a document that you feel most comfortable with. So, you know, I can tell you a bunch of things, but if you're not comfortable with a document or how it's feeling towards you or how you feel towards it, you know, see if you can find another document. Second, you need to remember that every state has different documents and different document requirements. So, you know, the one that we have on the screen, which is healthcare, which is Honoring Choices Pacific Northwest, is good for Washington State. You could not use it. It wouldn't be the same legal document, say in Idaho or Jersey or Florida. And, you know, there are different options for if you want to look at, I have this on the last slide, like Prepare for Your Care has a version for every single state. So my first piece of advice is use a document that works where you live, that you feel comfortable with. The second thing I want to highlight is that, you know, the nice thing about a durable power of attorney for healthcare, naming the healthcare agent, is that tends to be your own document that you can make your own. You can add your wishes, you can add more detail. Typically, it's got more space, whereas a healthcare directive or a living will tends to be like, here's the scenario, you can do one of two things. And so just know that there's that difference too. But, you know, as you're looking for things, I like documents that provide space for you to really say in your own words what's important to you. That's my preference. Where I like documents that give you the option to name alternate healthcare agents, so that there's a list of 3 or whatever, so that if for some reason they can't get a hold of the first one, or the first one can't do it, they have other people. So those are a couple of things. I also really like documents that tell me exactly how I need to complete the document. So like, here you need 2 witnesses. Here are the requirements for witnesses, so that you're very clear up front what you need to do, because you don't have to have a lawyer to do the healthcare directive or the durable power of attorney for healthcare. So those are just some quick pieces of information. More questions or no? Good. Okay. So I want to highlight the difference between the 2 documents that are the Honoring Choices documents that are on this side of the screen, and the physician's order, POLST. Some places it's called a MOLST, medical orders. So the healthcare agent and the healthcare directive, the living will, those documents are really about what if. They're about future healthcare. What if I'm in a hospital and I can't speak for myself? What if I need someone to make decisions for me? Whereas the POLST is really about what is my healthcare decision? What is my healthcare? What is my health now? And what do I want to have happen? And I know that can be a little bit like, how does that work together? So let me just talk you through like a scenario of what that might look like. So the physician's order can be done by emergency responding technicians, EMTs, whereas the other 2 cannot. So because it's like if a doctor is standing over them telling them what to do. And so and we'll talk about how you complete it and how you do that in a bit. But so if an EMT comes into your home and sees POLST and they do what it says, and then they take you to the ER, for example, they're going to take that document, that POLST, with them, because that document will actually travel with you. The other 2 will not. So you have to share the other 2 proactively. And you go into the ER, and the ER folks do something, and they're looking at their POLST, but they also have an advance directive for you on file. So they're kind of looking at both. And then they check you into the hospital, and now they're really looking at the advance directive. The POLST is still in your file, but they're really looking at the advance directive while you're in the hospital. And then after the hospital, you go to a rehabilitation facility. So your advance directive doesn't go with you, but the POLST would. So that sort of gives you a kind of an idea of how it might flow. It's not like clear lines all the times. They sort of interact. But what you need to know is that the physician's order is really about what someone is doing to you right now, and what care they would or would not give right now. Whereas if you get to this situation, what care might they do or not do? I know it's really muddied. I apologize. It's hard to, it's even hard for me, and I'm like in it all the time. It's hard for me to understand some days. So what is the durable power of attorney for healthcare? The durable power of attorney for healthcare is, like I said, I love this document. I tell people to color outside the lines on this document all the time. You know, if you don't like a phrase, scratch it out. If you want to add your own words, write them in. It really is a place for you to describe those personal values and goals for treatment. So remember I shared how what brings me joy is my dog and playing with my dog, right? So my document, I have that reflected, right? I say, you know, I love playing with my dog. My ideal state in playing with my dog is a very aggressive, sort of down on the floor, one-on-one with my dog. I also add a meaningful state. So I have an ideal state and a meaningful state. My meaningful state is being able to interact with him in a way that lets him know that I love him and maybe includes a little bit of play like me tossing a ball. Very two different states, but it helps the person who might have to make decisions for me understand what I really, really love and what I would be fine with. So that's what you can do on this document. This is also the document where you choose your healthcare agent. Don't go anywhere. I'm going to tell you who makes a good healthcare agent. You know, it's important to remember that this person, your healthcare agent, only makes decisions for you if you cannot. And also I get questions like, if I name someone, do they have to be a family member? No, they do not. Do they have to pay the bills for the medical choices they make for me? No, they do not. So, you know, when you fill this out, at least in Washington State, the document needs to be witnessed or it can be notarized. You don't have to do both. You can either have two witnesses or you can have it notarized. In either case, the witness or the notary is going to have to watch you sign that document. Now, why do you want a healthcare agent? Well, I have news for you. If you don't choose one, it's already been chosen for you. So, you know, what you see on the screen is the Washington State, what we call a hierarchy of decisions, who they go to. And the first person is a guardian. That's rare. It's appointed by the state. It's a court process. Then your healthcare agent, if you've named one. But the next one is your spouse or your registered domestic partner. This happens even if you're separated, if you're not legally like divorced or legally separated, you know, that relationship is nullified. You know, they can still be called to answer the questions. And you might be sitting there thinking, oh, that's fine. I'm fine. Well, what if something happened to both of you at the same time? Do you have adult children? Do you have more than one? Because if you have more than one, they're all going to have to agree. I love my brother very, very much. We do not agree on a lot. And so certainly in a time of crisis, it becomes even harder. And again, you know, maybe you're comfortable with that, but look down that row because they will keep asking people until they get someone to make those decisions for you. Like I said, if you don't select it, it's already selected. So you might as well, best practice, go ahead and proactively name that person and name a couple of others, backups. You know, I think about my husband and I, you know, things could happen to us. We're also aging at the same rate. So, you know, that's something to think about. Maybe in a couple of years, I want to name someone younger. Things to think about. So who makes a good healthcare agent? Well, you want someone who will say yes. It's like yes to the dress, except it's yes to the role. You want them to want to do this, right? You want them to talk to you about your own personal goals, values, and preferences, right? I said earlier, this person is really your voice. It activates, it's your advocate. Excuse me. You want them to follow your decisions, even if they don't agree with those decisions. It's very possible for people to understand that what they may do is not what someone else would choose, and still be a great advocate because they're happy to advocate for that person's own choice. And then you want this person to be able to make decisions in difficult moments. I'm going to be honest with you. When people make these decisions, they're not usually in a calm, I mean, it's often in crisis or it feels like crisis. And so you want someone who can make those decisions in that moment. All right. So those are the 4 traits to look for. And, you know, sometimes people hit 3 out of the 4 and maybe that 4th one you can get them to. I'm telling you, sometimes people don't agree to the role because they're scared that they're just going to have to make decisions. But once you start saying, well, I'm going to tell you what I think, and then they come around and they're like, oh yeah, I can do that if you help prepare me for that. I'm going to get a quick sip of water. Okay.
Can I ask a question while you're hydrating?
Yes, please.
Okay. Well, it's, so important that people designate, backups in case something happens. And I know you're talking about how to determine who your A team is. What happens when you need to make changes? Is it okay to create an addendum to these documents, or do you have to kind of completely redo everything every time you have an update, like when you move or someone dies or something happens?
So you're probably not going to like this answer. If you new document, I'm not saying you have to change your values, but you do need to rewrite and make a new document. That's really important. And because it's stated and they can see that, maybe you've written like, this is what a good day looks like for me, and this is going to stay the same, but now it's a different person. I just went through that. I had named someone that I worked with, and our working relationship changed. We were friends primarily, and then our working relationship changed. So I had to take her off. I had to take her off, which is hard. And, but now I know that she knows what I want. So even if she's not named, she can support the people that would make those decisions. So you can't really do an addendum. I am a strong believer in having clean documents so that it's very clear to whom, people who are reading this, who are looking at it and trying to figure it out. You may never have met them. They may not know you. They may not know who you're talking about. And so I am, the clearer you can be for them, the easier it will be for them to make decisions. That makes sense? Yeah.
Perfect.
Right.
Thank you. That's helpful.
Yeah. Okay. All right. Healthcare Directive Living Will. These are usually very narrow parameters, like terminal condition, permanent unconscious condition. It certainly is in Washington State. And this is where you just say, yes, I want life-sustaining treatment, or no, I don't. There's no gray area. And it's usually nutrition and hydration, and it's very specific. So just remember that the other document, in my view, the Durable Power of Attorney for Healthcare, provides a much more rounded and complete picture of who you are and what's important to you and what a meaningful life looks like to you, whereas this is very, very narrow. So just so you know, this, like the other document, it needs to be witnessed or notarized. And again, pay attention, because I'm going to tell you, spoiler alert, in Washington, the witnesses who can witness the living will are different than the witnesses who can witness the healthcare agent document. There's a lot of overlap, so just if you're using witnesses, just make sure you're very clear on that. Some of the things that can help you, I was hearing people like, how do I communicate this? How do I make sure this is heard? You've got some ideas there. The key thing is clarity. Capture that key information. If you're filling out a document and a section, you don't want to answer it or it doesn't apply to you, cross it out. Let people know that you've seen that section so they don't think you've accidentally skipped over it, so that people know that you've paid attention to it, so they're not wondering. I certainly, in the Durable Power of Attorney for Healthcare, get rid of those unwanted words, add your own phrases. Like I like to say, color outside the lines. That document should be a reflection of who you are. Make sure, we talked about the witnesses, so know that, and make sure you talk to your providers and those who matter to you. And as I've alluded to several times, be patient. Be patient with yourself as you go through this process. Be patient with others as you start talking to them about it. It is, it is hard. It can be hard to start talking about this. And, at least with me, I've figured it out. I've talked about it to myself several times, and then I tell my amount of time to process it. So just know to be patient, and it's okay. So really quickly, I want to tell you about the POLST, because there tends to be some confusion. The POLST is for the seriously ill or medically frail, and that's at any age. So what I want to let you know is that you can have a healthy 70-year-old who does not need a POLST, and you can have a medically frail teenager who does. So I like to just point that out. It is medical orders, as I said before, but it's for specific procedures, CPR, ventilation. It needs to be taught, it needs to be signed by a doctor or provider, as well as the patient or their legal representative. And something that I like to elevate here too is, like, you know, not everyone should have a POLST, but if there are certain things you definitely don't want to have happen, certainly in the field, and by in the field, I mean like in your home or someplace else, you're going to want to talk to your doctor about that and see if a POLST makes sense for you. I can't tell you, I'm not a doctor, and I'm not your doctor, but so it's important to know that just because you're older doesn't mean you have to have one, and you know, that it can be used to encourage procedures or treatments as well as stop them. Whew. Okay, so just so you know, and then I'll take more questions and I can hang around as long as needed. You can find more help at a lot of places. Honoring Choices PNW, that's where I exist. We have information and resources there. There's a contact form. You could also email if you want to get in contact with me. Just ask for the blonde. I'm the only blonde, so feel free. Prepare for Your Care, I mentioned earlier. They have forms for all those states. They also have videos before each section to help you get through those different sections, and they offer it in Spanish. The Conversation Project is sort of like the mothership. It's a great place to go for a lot of kits and aids. You can follow, if you're on social media, I encourage you to follow us, because we often ask questions, provide ideas, link to different events. And speaking of events, I am going to let you know that we're doing something called Celebrate NHDD. National Healthcare Decisions Day is April 16th. It is a day where organizations and individuals throughout the country focus on advanced care planning, and we have a ton of events. We're doing plays. You can come and see a play this upcoming Friday, or if you know, if you speak Spanish or you know someone who does, we're doing it in Spanish on Sunday. We have a game show a week from Friday with a celebrity guest host who has been nominated for an Emmy 3 times. We have a video challenge. So if you don't want to you know, see a play or answer questions, you can do these questions and take little video vignettes, snippets of yourself answering these questions that are not, they're go to advanced care planning, but are not all about necessarily about, oh, death, but like, who do you trust? And you can share those to help start your conversations. We have playlists, so if you need music to get you, we have a quiz that you can take that will tell you how many people you might be called upon to make medical decisions for you. So join us there if you want, or just reach out or what have you. And Beverly, I am ready for a lot more questions if we have any.
Oh, I'm so glad to hear you say that. Well, first of all, thank you so much. This is always so informative, and there's just always more to learn. I'm so excited, and I'm really excited to join some of your NHDD celebrations, and I'd encourage all of our attendees to give it a look. It's really valuable information. It can be a really useful conversation starter when you're thinking about tackling some of this stuff with your care team. You know, who in your friends and family would you be leaning on? They might appreciate an introduction into the subject that's a little more fun and a little bit more engaging in multimedia than sitting them down for a conversation at the dinner table.
Yeah.
Well, okay. Will you please repeat which of those documents you have to have the different witnesses for? A couple of people wanted to make sure they wrote that down.
Yeah. So at least in Washington State, it's the durable power of attorney for healthcare. So where you name your healthcare agent. The witnesses needed for that are different than the witnesses needed for the healthcare directive, where you select what kind of treatments you specifically want. And the difference is, they're not huge. You'll find, like if you're getting your neighbors, you're probably fine. But I just like to highlight it because I don't want a document to not be valid because the witnesses are challenged.
That's really helpful. I need to know that as a notary. For folks that are in attendance, actually, at PMA, we have 2 notaries. I am fully vaccinated and ready to socially distance notarize documents. I know it's been really tricky to find institutions that are still offering that service because of COVID. So if you'd like to go ahead and reach out to PMA and make an appointment, I can help you get that part of this kind of hammered out. So that information about the witnesses for documents is something I'm filing away mentally.
And just so everyone online into the chat box, just in case. Are you still there? Okay,
Oh
good.
yeah, I'm sorry, my laptop's getting sleepy. So let's see. Oh yeah, so once you go through the whole process to make all these decisions and write them down and get everything signed off on, where do you store these documents? Do you keep them like with your passport, or like, what do you do with them?
Oh, thank you for asking that.
I can't even take credit for it. It was one of the
These are documents you want to share.
Yeah.
Yeah, these are documents you want to share. So, you know, if you can, make a copy and give it to all your providers. Obviously, give a copy to your healthcare agent. The one on our website is fillable, so you can download it, fill it, and you could share it electronically. You can, you know, maybe you have a person of faith that you want to share it with, so that they know. Sometimes people want to talk to people of faith to know what to select. Also, one of the best practices I ever saw was my ex-stepmother, who I'm still very friendly with. And she had a binder, and she had all of her major documents in a binder that you know, not the stuff that would like compromise her Social Security or whatever, but like her healthcare directive, her funeral plans, that sort of stuff, in a binder that was like, you would walk in the door and there was a bookshelf and she had it right there, and anyone who might have to make decisions or might need to do something could walk in and see it. And so what I want to say is that wherever you put it, you don't need to put this in the safe. You need to put it in a safe place, not the safe, and you need to let people know where they can find it.
You know, I get this question a lot, and I'd love if you'd speak to it. You know, with how spread out we all are, and with, you know, the different precautions long-term care facilities have to protect folks from COVID. Is there a difference in the format these forms are kept in? Does someone have to produce the original documents, or, you know, if they have a photocopy, can they share that?
So I think I heard you. Yes. So keep photocopy. I've heard stories where the healthcare agent shows up and says, I'm a healthcare agent, here's a copy of the document. You know, so a copy is just fine. The kicker is that if you change things, you need to make sure those people get a copy of the changes. So that's the kicker. But the original, like if you want to make sure your original is kept someplace safe, you know, you can keep it with your lawyer or your provider or what have you, but always have copies that are readily available, I think, is the best practice.
That's a good tip. We have a couple people that are curious, like when we're talking about a POLST, is that the same thing as when we talk about having a DNR?
No, it's not. Although they might do the same thing. So a DNR is usually just within like the facility itself. So it won't travel with you. So they'll put it in your chart that you are do not resuscitate, which means, for people who don't know, is that they're not going to try CPR on you. Okay. So just know that a POLST is portable. That's one of the key things to know about a POLST.
Okay, so yeah, someone also asked, you know, that POLST stays with our doctor, right, or at the institution, or do we keep it at home?
So there may be copies kept at different places. And, you know, traditionally the POLST in Washington State is on bright green, but it doesn't have to be on bright green to be legal. It just needs to be signed. So if you have a POLST, your doctor would keep a copy, obviously, and you'd probably have a copy that you post inside your house, someplace where emergency responders could see it if you think that would be needed. A lot of people keep them on the refrigerator, for example.
Okay. All right, we're in the home stretch. You ready?
Yeah, I'm trying. I'm ready.
Okay, so someone is curious, are there special documents for folks that have dementia? Like, are there any things you can add to this whole pantheon of documents?
Yeah, I know that's a question that's on a lot of people's minds.
Yeah.
So, so the great thing about an advanced directive is that it really, it is future decision-making, healthcare decisions. But
Mhm.
there are some unique questions, I think, around dementia. So there's, and I can make sure I give you the right link. There's the Dementia Directive, which was developed by a doctor at UW, which is very, it's not a legal document, but it's very detailed in what it goes through. End of Life Washington also has a document on their website.
Ooh, I
that
love
has
the
a
one
lot
they
of
have.
interesting questions about, things to think about, because dementia, can present itself in different ways for different people. And so there might be a multitude of different things to think about. One of the things I do want to say is, often people get worried about a dementia diagnosis. And so I think once you get the diagnosis, you need to start planning it like immediately. I think the urgency becomes much more real. And to remember that people might have capacity in different times of the day or different. So just because someone has a diagnosis doesn't mean they can't make decisions. It just means you may have to be very cognizant about when would be a good time for that decision making. I am not an expert on this, so that's all I'm going to say on that. But what I would recommend is that checking out a lot of the different resources, and I can make sure, for example, that the Dementia Directive website, I get to you, Beverly, so you can send it out to everyone.
Wonderful. Yeah, just a reminder to everyone, I'll be sharing the recording from today's presentation, as well as links to these resources. There's so much great information out there, and it can be tough to figure out where to start. So we'll certainly share some options. And I've gotten some great suggestions from folks directly messaging me to let me know this is something I tried and it worked really well for me. So I'll make sure we just have this wealth of options. When you're talking about checking in with the experts, someone's curious, are there professional organizations that would serve as your healthcare agent, and how would you find one?
That's a great question. So, and actually it's something that's been elevated more and more recently, at least in my sphere. It doesn't mean it didn't happen before I was aware of it. One place I can talk about is Health Advocate X. So Health Advocate X is is an organization that tries to help activate people in their own healthcare, and they have a list of people who are willing to be healthcare proxies or agents. And there are other organizations listed on that organization website where you can also find more people. What I do want to just sort of give a heads up to is that usually this costs money. And so, there are financial implications based upon that. There are also some great places that do work. I'm thinking of like a Sacred Passing, where you can get a whole death plan, and so there are more resources out there. There are a lot of great, what I would say, grassroots organizations doing a lot of great work, and it's hard sometimes to know all of them. But Health Advocate X is a place that you could start to try to find someone who might be willing to be a paid healthcare proxy. And what you would want to look for is, as you look at those people, do they mention healthcare proxy in their little bio?
Wonderful. All right. Thank you so much, Bonnie.
Yeah.
Just so much wonderful information to chew on. If folks find that later on questions occur to them, would it be possible to check in with someone like an advisor or a counselor or somebody at Honoring Choices?
Yeah, so just, you can send us an email at info@. You can go to our website, that Honoring Choices PNW website, and there's a contact page, and it has ask a question. We do services, so if you want to speak to someone one-on-one, we can help do that. And we have a find a resource button on our page where you can enter your address and see maybe people who are closer to you. Since we're based in Seattle, I don't know where everyone is. And of course, if you go to the Celebrate NHDD.online, there's a contact page there. Whatever your needs are, if you have more questions, if you have different needs, reach out. We're happy to help. And if we don't know the answer, we can't help you. We will help get you to someplace who, or someone who can. That's what we do. We like helping people. And I hope everyone out there, I hope you got something that was helpful and useful and you can take it and apply. If nothing else, I hope that you realize something that brings you joy.
Thank you so much, Bonnie. Nancy, did you have anything you wanted to say before we close out today's session?
I hope that you can hear me at this point, but I'm sorry about our survey. The link doesn't seem to be working, but we will send it out to you in our follow-up email. And I just want to thank both People's Memorial Association and Bonnie from Honoring Choices for a great Q&A and lots of great information. So thank you.
No kidding. Please feel free to reach out to PMA or to Honoring Choices at any time. And like Bonnie said, if we don't know the answer to your question, I bet we can find a friend who's pretty knowledgeable in a similar organization. You know, we're committed to the democratization of information. That's what we're all about. So we really hope to see you at some of the future sessions in this series to learn more. We've got one on funeral options and also one on estate planning. So we're really covering the full range there. Thank you so much, everyone, for joining. I'm going to go ahead and close this out for today and stay in touch. You know, we love to get this information out there and empower Washingtonians and, you know, everyone at large to get the information they need to get the care they want and the death they want. And then Nancy, if you and Bonnie wouldn't mind sticking around for just a second, we'll touch base after everyone else leaves. Sure. Thank you, everybody. Have a great day.